That's okay.
But to welcome all of you here, I'm going to introduce Jamie Slotman, who's the CEO and Plan President of Louisiana Healthcare Connections. Come on up, Jamie.
Well, I didn't expect that, so thank you, Governor. I appreciate it. As the Governor said, my name is Jamie Slotman. I'm the CEO of Louisiana Healthcare Connections. We're part of the Healthy Louisiana Medicaid plan. We're the largest plan here in the state. We cover about 470,000 Medicaid recipients. We're based here in Baton Rouge with 5 offices covering the state and over 600 employees. And we are committed, our mission, to improving the health of Louisiana one person at a time. The reason we're here today is to talk about our grant announcement. So on behalf of Louisiana Healthcare Connections, I am pleased to be joined by Governor John Bell Edwards and Washington University Associate Professor Amy McQueen for the announcement of a 5-year, $2.9 million grant from the National Institute of Diabetes and Digestive and Kidney Diseases. This study will address how basic needs affect health outcomes among Medicaid beneficiaries with type 2 diabetes and be conducted by the Involved Center for Health Behavioral Change in partnership with Louisiana Healthcare Connections. This was a highly competitive grant, and the awarding of the funds shows the importance of this proposed research. And before I turn it back over to the Governor, I want to say, Governor, the last time I was here, I had the pleasure of standing over here to the left, and you signed your first executive order, which was Medicaid expansion. And I wanted to thank you for that. I wanted to just tell you a couple things. Since Medicaid expansion of July of 2016, Louisiana Healthcare Connections, we've connected over 187,000 Medicaid lives to doctors that were not being seen before. We identified and began to help 15,000 Medicaid expansion members with diabetes, and we filled over 4,000 insulin prescriptions. So, Governor, thank you for that, and we appreciate it. And without further ado, Governor.
Thank you, Jamie, and thank you very much, Dr. Amy McQueen, for being here today, and for all of you all for joining us. It is great news for the state of Louisiana, and it's another step forward to producing better health outcomes. And everybody acknowledges that health outcomes have been too poor in Louisiana for too long. I believe we're making considerable progress, but this is yet another step on that journey. One of the things that I'm most proud of is the progress, in fact, we've made on improving health outcomes since we expanded Medicaid, and Jamie was just giving you a snapshot of that as it relates to Louisiana Healthcare Connections. More people have health insurance in Louisiana than ever before. More people are going to the doctor. More people are being diagnosed and treated for conditions that previously they would not have even known that they had. And since coverage began in Louisiana under expansion, nearly 11,000 individuals have been newly diagnosed with diabetes. And that's why I'm so excited about this particular grant that Dr. McQueen is going to talk more about in just a moment. So this grant is going to give us an even better understanding of the needs of those suffering from diabetes and how to provide the most effective methods of care, as well as how to promote better, healthier lifestyles here in Louisiana. The impact of research funding is both medical and economic. It represents a return on investment that improves health, saves lives, and drives growth. For example, in 2017, Louisiana had almost 3,000 jobs supported by $142 million in National Institutes of Health funding, which in turn created over $418 million in economic activity across the state of Louisiana. Creating solutions for improved access to resources for basic needs leads to improved health outcomes and lower costs of care. I'm grateful for this grant and the opportunity that it gives us to move forward, and I look forward to improving health outcomes for those suffering from or at risk of diabetes. And now we're going to hear from Dr. Amy McQueen, who is the Associate Professor in the School of Medicine at Washington University in St. Louis. She will serve as one of the principal investigators for this research project, and she will now describe for you the scope of the project and its impact. Thank you, Dr. McQueen.
Thank you. I'm very excited to be here today and representing the research team at Washington University. We had conducted research on the social determinants of health, and we focused on what we call basic needs or unmet basic needs. So that might be anything from food insecurity, housing needs, whether you need housing or you need something for your house or some repairs done on your house. We hear people need dental care or job help with either applications or training, childcare, you name it. There's a lot of problems that people deal with on an everyday basis, and we know that health gets kind of the second attention, and that's on a good day. So we also know in our research that the more of these unmet basic needs you have, the more you are focused on today, not tomorrow and not next year or some future risk that you may or may not, ever see. You have a lot more stress and a lot worse sleep, which causes all kinds of other attention problems and focus and ability to plan and follow through with things that you need to do. And in our research, we found that when people had more unmet basic needs, they didn't even remember getting health referrals or health information that we mailed to them, and they were in our studies. So we want to think bigger and, experiment with this to see. We know that from our other studies that having a personal navigator, someone who can check up on you and provide support and facilitate and help with the follow-through, that actually reduced or resolved some of the unmet needs and allowed people to engage in health referrals that they had gotten. And so bringing our research experience and interest together with an enthusiastic partner like Louisiana Healthcare Connections has been an amazing opportunity. We've probably both had some learning and true partnership to design kind of that win-win where we can test scientific principles and look at how a program like navigation can directly affect health outcomes as well as social outcomes like diabetes distress, feeling like you're overwhelmed by taking care of all the things you have to do for diabetes self-management. And so specifically for the trial, we will be conducting what we call a pragmatic randomized control trial in this very real-world setting. We will recruit and randomize 500 Louisiana Healthcare Connections members who have type 2 diabetes, who are not already involved in the case management program. We don't want to confuse or interrupt the services that are already being, impactful. And we're looking at kind of the next tier and hoping to prevent those from, being in case management. Will be conducted at this program at scale, so we will be open to everyone statewide. We're going to be providing navigation by telephone, and that will involve any opportunities for health services that are already available to members in the health plan, but more specifically focus on the community and social service agencies that the member may benefit from or find resources from, and try to facilitate that relationship. We'll look at a variety of outcomes, including things like glucose management, A1C changes, as well as utilization. Are people seeing their provider? Are they going to the ER or the hospital? And then quality of life, diabetes distress. We also look at the cost effectiveness of providing this navigation on these different outcomes. And then lastly, in addition to the trial participants, we're going to work together to analyze health plan data to really understand what needs are more prevalent across the population, so not just with the diabetics, but with the whole plan. And this is an opportunity to identify where there are certain subgroups that also might benefit from particular interventions or programs. With this larger population, we'll be able to look at the prevalence of different needs, whether they cluster, and whether there's some specific needs that have greater impact on certain outcomes. We may or may not be able to do that with the smaller trial participants. So we'll have both pieces to inform each other and then certainly inform the future. Well, this is definitely a very ambitious project, both from the research side and the operational side. I'm very excited to be working with such an enthusiastic and very dedicated partner in health, in Louisiana Healthcare Connections. And we're looking forward to the next 5 years and maybe the 5 after that. I think we're going to be doing some great work together. That's all I have to say.
Perfect.
Turn it back to you.
Yeah, so thank you very much for those, the great explanation of the program. So if there's any questions, we'll be happy to entertain at this time. If they're very technical, I'll go this way. If they're really hard, I'm going to, no, I won't do that to the governor.
Break it down just for folks back home. What does the grant, or what are the benefits of folks in the program, or just folks across Louisiana? What are the benefits they're going to see out of this?
Yeah, and I can let Amy talk to some of this too, but just from what I've looked at, you know, the first thing is we do a lot of work at Louisiana Healthcare Connections around case management and care management, and a lot of that is looking at navigating the healthcare system. But this grant is going to allow us to go a step further. So we're going to look at a lot of social determinants, which you hear a lot more about today. Transportation. Are you having trouble with job training because of your your management of your diabetes type 2? And these are a lot of people that we're going to be looking for. They're really not on the radar per se when you look at them. They're not always going to the ER. They may or may not be taking their medicine, so we don't see that in the claims data. But it's really going to get a benefit, whole person, if you will. So, Amy, I don't know if you want to add some things to that.
Yeah, just one thing to add too is that we're hoping to catch people before they really are sick, before they would start to come into the health plan's radar. Oh, look at this patient who's had 2 ER visits this year. Let's reach out to them and offer them help and get their health stable and see what else they might need. We are taking the approach of we know who has diabetes, sorry. And so of those who aren't already being reached out to, let's just reach out to them to better understand what needs they have. So we'll have a better sense of that next tier before hopefully they go on and hopefully, you know, we can prevent some of that.
Thanks, Amy. Any other questions? Well, I'll just say thank you all very much. Governor, do you want to?
No, I just want to thank Jamie and Dr. McQueen again. At the end of the day, this is about figuring out whether there are things that we can do that will produce better outcomes among individuals with diabetes while potentially spending less money. I think this is what we're required to do, and I'm excited about it. We're going to learn a lot of things, and some things will work, some things won't, but that's what this randomized trial is going to be about. And so I'm anxious for you all to get started, and let's that's right, and let's continue to improve health outcomes in Louisiana. Thank all of you very much.
Thank you.
Thank you, Jamie.
Thank you very much.